Welcome to Premier Pain Talk, a podcast dedicated to expanding awareness about treatment options for people in pain. Each week, host Dr. Michael Danko from Premier Pain Treatment Institute in Cincinnati, Ohio, discusses cutting-edge treatments for pain management that are improving the quality of life for those suffering with chronic pain. Tune in now to learn more about how to relieve pain and restore your quality of life.
Welcome to Premier Pain Talk. This is your host, Dr. Michael Danko from Premier Pain Treatment Institute in Cincinnati, Ohio. Going to bring to you a few new procedures today that we're excited to be adding to our offerings at Premier Pain Treatment Institute and at our ambulatory surgical center, Premier Surgical Institute. The first procedure that I want to talk about is a procedure I've been doing for a couple of years now, but as it's gaining more and more visibility within our space and gaining more traction and more physicians are doing it, I think it's a great time to kind of remind patients that this is an option and help people understand that this is a potentially great new treatment option. And that is something called Basivertebral Nerve Ablation. Then after that, I am going to discuss a newer procedure we're going to be bringing to the surgery center called RF Blade. It is a treatment for vertebrogenic back pain. That is really kind of the next step after a radiofrequency ablation. And then the final procedure I'm going to talk about is another new procedure that's going to be coming down the pike called lift. And lift is a form of treatment for a condition called spinal stenosis. So kicking it off with basivertebral nerve ablation, this is a treatment for a type of pain that we call vertebrogenic low back pain. So what that means is that the pain in your back that is sharp and it can worse with activity, worse with movement. It doesn't typically go down the legs too much. It kind of stays more in the back and hips. The way this pain starts is that you just start to develop degenerative disc disease, and as your discs start to wear out, there is some noxious chemicals that will leak into the bones adjacent to the disc, which we call the vertebral bodies. And so the way this shows up is a radiology term that we call modic changes. And what these changes are kind of markers and color changes on an MRI that ultimately help us realize that there's some swelling or inflammation, other noxious chemicals inside the vertebral body that are irritating a very large nerve in there called the basivertebral nerve. And so the way we treat this pain is that we do a heat treatment to that nerve. And that is a needle-based procedure that is done in the surgery center with sedation, so you don't really need to be awake while it's going on. And place a needle alongside the nerve before it starts branching out inside that vertebral body, and then apply a heated stimulus for several minutes. What that does is that cauterizes that nerve and stops it from sending pain signals. And so one of the pretty interesting parts about this procedure is that nerve doesn't regenerate. So most of the nerves in our body regenerate because they have something called a myelin sheath around it. And that's why if you have a kind of a minor cut on your finger, you don't have a permanent numb spot on your hand for the rest of your life. As that cut heals, those little small nerve endings in your finger will, as long as the damage isn't too bad, they'll regrow. And so a lot of your nerves have that sheath that allows the nerve to regrow over time, but the basivertebral nerve does not. So when you heat treat it and you get rid of that axial back pain, that low back pain that's related to the inflammation inside the bone, that pain is pretty much gone for good. It's not going to return. That's pretty exciting. There's good level 1 research data supporting the procedure and showing longevity of the treatment. And ultimately, there are a few things we do in the workup leading up to it. It's very common that you need to do physical therapy or a structured home exercise program. We need an MRI scan. So those modic changes I talked about you need an MRI to be able to see them. They're not going to show up on X-ray, and they're not going to show up on a CAT scan. And then you need to have generally tried some basic treatments prior to that, and then occasionally some of the insurance companies will require a psychological clearance prior to the procedure. to be 100% transparent, I think it's unnecessary, and I think it is kind of an adopted requirement from other procedures that require psychological consultations, like a spinal cord stimulator or a pain pump. So I think that the insurance companies kind of didn't know what to do with this procedure when they were developing policies, and they just kind of modified some existing policies they had. So a lot of the insurances will require that, and so if we asking you to send you for a psychological clearance part of this procedure, just kind of realize that's part of the standard workup and what needs to be done. But once we've got approval procedure, we like I mentioned, take it to the surgery center with we do it with anesthesia, treat that nerve, and then within about a week or two, sometimes faster, that nerve will stop sending signals, and the back pain will pretty rapidly improve. And then, like I mentioned, the durability on the procedure is really good, and we've been excited to be offering it to the patients over the last couple of years. And as there's more and more awareness growing on the procedure, we're doing more of these more frequently, and we're seeing really nice results. So after that, we're gonna shift gears. I'm gonna talk to you about another new procedure, as I teed off at the beginning. This is a procedure called RF blade, and what this is it's a spinal nerve avulsion and a partial facetectomy, which is a kind of a word salad that says we're treating pain coming from the joints in your low back, what we call the facet joints or facetogenic pain. Another diagnosis that you might see on your medical records in your MyChart or on your portal. Something called lumbar spondylosis, and that's basically the medical diagnosis that kind of relates to pain generated from those facet joints. Typically, facetogenic pain is pretty similar to the vertebrogenic pain I was just talking about, and it's a dull, aching low back pain. It's got a lot of the hallmark characteristics of other arthritic joints. So if you have arthritis in your knees, your shoulders, your hips, you know what I'm talking about, but it's harder for us to conceptualize these small joints in our low back because we have a lot of them and they're pretty tiny, and we can't really touch and feel them like we can our large joints in our body. So standard treatment for facet-related pain, like a lot of our procedures, we need to do some physical therapy or an exercise program. Need to get at least X-rays where we can see the arthritic changes on the joints. And then the most standard treatment we do is a different type of ablation. So I talked about the Basivertebral Nerve Ablation before. There is something called a radiofrequency ablation, which is probably the kind of ablation, if you've had treatment for your spine before and they've done what they call an ablation, this is more of a standard ablation. So we do something called a lumbar medial branch block as a diagnostic block to see if the pain from the facet joints that have arthritis on them is where your pain is coming from. And we do 2 of those blocks, and we prove that that's where the pain is coming from. Then we do that radiofrequency ablation, which is a injection-based procedure we do in the clinic, and we apply heat to the joints. And that heat treatment will usually improve the pain for about 6 to 12 months. Insurance will usually approve it to be done twice a year, either once on each side of your back or twice on the same side. But with that procedure, as there is with a lot of procedures that we do in medicine, we don't have a 100% success rate. So what do we do when a radiofrequency ablation isn't lasting long enough, and maybe it lasts for 6 months, and then you have 6 more months before insurance will allow you to repeat it because you're treating each side? What if the procedure lasts for 3 months and just never really even got to that 6-month mark, and then insurance won't let you repeat it? Or you have really good results with the nerve blocks, but for some reason the ablation just doesn't really take quite like we want it to. These are scenarios that we deal with some regularity. So we know from a lot of our clinical research that the ablations have at a pretty high success rate but for those patients that doesn't have good success for, there's been a bit of a treatment gap because arthritic joints in the spine typically are not a surgical condition. So it's not like you can send to the neurosurgeon and do a spinal fusion. That's not how arthritic treatment works. And these little joints in the spine are small, and they can't get a joint replacement like you could a knee replacement or a shoulder replacement or a hip replacement. So what I'm really excited about is a newer procedure we're going to bring into the clinic called RF blade. And this is the spinal nerve avulsion is really a surgical ablation of the nerve. So also this nerve is kind of enveloped in the capsule of the facet joints. So what we're going to do is make a little teeny incision and then go down to that facet joint and more directly avulse or ablate that nerve and perform what we call a partial facetectomy to remove a little bit of the facet joint capsule to get access to that nerve, so we get a really good lesion of that nerve. And what this is going to do is going to provide a much more durable, long-lasting treatment to the facet joint. This is a procedure that, starting out, it seems to have pretty nice insurance coverage. So a lot of patients are going to be eligible for it. So sometimes with newer procedures we bring around, it takes a long time for the insurance companies to allow us to do the procedure. And there's limited access. Well, there seems to be pretty nice access to care for this procedure, which I'm excited about. And it's going to be, I think, a fairly straightforward procedure with a fairly quick recovery. I expect that treatment should improve within the first 1 to 2 weeks, and then expecting a pretty significant duration of relief that surpasses the rate of frequency ablations. It's very likely that we'll be participating in some clinical research opportunities as we look to evaluate the procedure more. So sometimes that will open up more access to care for patients. In general, it's a needed treatment modality that we're going to be excited to offer at our practice and at the Ambulatory Surgery Center. Okay, the last procedure I want to talk about today is a procedure called lift, and this is a laminotomy procedure for a treatment called spinal stenosis, and we're treating the kind of the symptoms that go with spinal stenosis that we call neurogenic claudication. So there's been a fairly typical treatment pathway for spinal stenosis in our practice that has been pretty successful, but there have been some treatment gaps, which I expect this procedure to really help with. The way stenosis works is as degenerative changes happen in the spine, and sometimes there's some instability and other things that cause a little bit of shifting of the bones where the canal is more narrow. And so when you have a more narrow spinal canal, there's not as much room for your nerves to breathe, so to speak. And so when you go to stand and walk and you're active and you're doing things, that extension of the spine worsens the stenosis and really amplifies the symptoms that you're feeling. And so people will have that steadily increasing pain in their back or pain in their legs or heaviness in their legs or numbness in their legs that develops. Often we see patients who do what we call the shopping cart sign. So when they're going through the stores, they need that cart, and you need to lean forward in the cart to lean forward and kind of flex the spine and create more room back there, help relieve some of the symptoms. Or maybe they're walking for a few and then they need to sit down and take a break. That is a pretty classic hallmark symptoms. And then we do some advanced imaging, either a CT scan or an MRI, and we see that the canal is more narrowed in that area. The initial treatment that we typically do for spinal stenosis is something called an epidural injection. So that is a corticosteroid injection into the spinal canal to try to reduce some of the inflammatory mediators and try to relieve the symptoms chemically. So if the conservative options like therapy and medication and things haven't worked, and we're moving on to the epidural injections, and then they don't work, then we got to kind of got to look a little further and see are there more advanced options, or what is the next step. The most definitive option is going to one of our orthopedic or neurosurgical colleagues for a more traditional spine surgery, whether that's a laminectomy discectomy procedure, whether that's a lumbar fusion, or another kind of tool they might have in their bag. But those are, as we know, those are fairly robust, big surgeries that sometimes have longer recoveries and depending on the pathology. One of the really great procedures we've been doing a lot of at PPTI, and that works really well, is in between there, and it's called the mild procedure or minimally invasive lumbar decompression. So that is a great procedure that we've had a lot of success with throughout my career for several years. That is a procedure that debulks what we call the ligamentum flavum. So there's a ligament that connects the bones in the back of the spine. It's a ligament that we go through when we do our epidural injections. That ligament can thicken and hypertrophy over time and help to clog that canal. So Spinal stenosis is generally multifactorial, means there's like multiple reasons that can kind of develop, but one of the reasons that can contribute to it is that ligament really thickening in the back of the spine and creating more compression. So with a mild procedure, we go into that space and we decompress through a tiny incision in the back and take as much of that ligament out as possible to create more room back there. And that has been a nice procedure. Generally, people will see kind of steady improvement afterwards. They typically improve about 10% per week, and they can continue to see results and improvements in their standing and walking and other activities through at least through the first 6 months after the procedure. So it's really been a nice procedure. It's called the mild procedure. But what do we do for those patients that don't have really significant ligament and flavum hypertrophy, and there's not a really thick ligament to debulk, but they have a narrowed spine, and they're trying to avoid a larger traditional back surgery. That's been a treatment gap that we've had, and there was a procedure in the past that was called Vertiflex, and that was a procedure where you inserted little spacers, almost like a little jack stand, and kind of propped the segment open, and that was a nice option for a lot of patients. But that procedure is no longer available. So since that procedure kind of came off the market, there has been a bit of a gap there where it's okay, how do we treat this patient if we're trying to avoid back surgery? Or we just say, okay, back surgery is your only real option. And I think that's right where lift is going to fit in our practice. So that procedure is similar to the mild procedure in terms of we are, through a minimally invasive approach from the back of the spine, making a small incision and going in there and creating more room and decompressing the segment. But it's not dependent on the ligament and flavum hypertrophy to be indicated for the procedure to be successful. So that is procedure we are identifying our initial patients now and getting ready to start offering at the clinic. And so again, that is a very similar recovery and expectations to the mild procedure. So we want to see steady improvement afterwards. It's going to be a pretty quick recovery. We cover that little incision with a little bit of medical glue called Dermabond, so you can start showering and doing your normal activities the next day. There's no back brace or anything like that you need to wear in your recovery. And it's basically, as soon as some of the procedural soreness starts to settle down, you can start getting back and doing your thing and living your life. And then we expect to see steady improvement, just like a lot of other stenosis treatment conditions. That you need to build your muscle strength. You need to get used to being able to stand longer, walk further, not use your cane anymore, not lean on the shopping cart. All that takes a little bit of time, but as you stick with it, you can see a pretty significant improvement over time with minimally invasive treatments for the spine. Again, like this RF blade procedure I talked about, one of the other really appealing parts of lift is that it has well-recognized insurance coverage already. So it's with the well-recognized access to care through the insurance companies. That also means a large majority of the patients can have that procedure done, which I think is really important when we're trying to offer a new treatment, as I mentioned before. So with that, I'm going to start to wrap up today's episode. So the 3 treatments that I want to talk about today. One is for a treatment called vertebrogenic low back pain. That is a procedure we've been steadily increasing our volume with and doing more of in the clinic, called Basivertebral Nerve Ablation. There are a couple of different companies out there that offer this procedure. So sometimes you'll hear the name Intracept, and sometimes you'll hear the term Optoblade, and those are both treatments. The Optoblade and the Intracept are the treatment, the devices that are used for the ablation, supplied by a couple of the medical suppliers out on our space, and then but the actual procedure name and what you're having done to your back is something called a basivertebral nerve ablation. So that would be the medical term for the procedure. Intracept is the offering by Boston Scientific, and then Optoblade is the treatment offering by Stryker. 2 great companies. I've had experience with both companies, both procedures so far. To ablate that nerve, and I've been really happy with the outcomes on both directions. And then the second procedure I talked about is called RF blade. This is a newer procedure coming to Premier Pain Treatment Institute. I believe will be the only practice in Cincinnati that's be offering this procedure on the front end of it. It is a treatment for vertebrogenic low back pain or arthritic low back pain related to the facet joints. It's ideal for patients who, when radiofrequency ablation has not been successful, and we're looking, or it's been successful but not providing enough relief, and we're looking for a more durable solution. Then lastly is another way to provide minimally invasive care for spinal stenosis, or that narrowing of the spine, that helping to fill that treatment gap between injections and traditional back surgery, and that's called the lift procedure. And so what that is another minimally invasive way to decompress the spine, similar to the mild procedure that we've been doing for several years in our clinic. And ultimately, these treatment offerings are help us to provide cutting edge care at PPTI, where we can really offer as many options as possible to our patients, because chronic pain is complex. And the more that we can continue to refine our skills, find new ways to treat these complex problems, figure out how to do these in a safe fashion with quick recovery and good outcomes, and that has really helped us bridge the gap between basic injections and procedures in the clinic and traditional surgery. And then in that middle ground, I think, is where a lot of our advances in care are happening, and where we can safely treat problems without long recoveries and extensive hospitalizations, and some of the things that can sometimes be related to larger surgical procedures. So with that, I'm going to wrap up today's episode. I appreciate you for listening in. Please try to follow us on all of our social media pages and subscribe to the podcast. And Premier Pain Treatment Institute, we have 4 convenient locations in Cincinnati, Ohio. We have Loveland, Mount Orb, Hillsborough, and Middletown. Our ambulatory surgery center is Premier Surgical Institute, and that's in the same building as our Loveland clinic, so conveniently located on the northern side of Cincinnati. And you can find more information on our website, premierpaintreatment.com. And thank you for listening. Take care.
Thanks for listening to Premier Pain Talk. This episode is brought to you by Premier Pain Treatment Institute, which has convenient Cincinnati area locations in Hillsborough, Loveland, Middletown, and Mount Orab, Ohio. Be sure to click subscribe so that you get updates on all our new episodes. For more information on Premier Pain Treatment Institute or any of the services discussed on this episode, please visit us online at premierpaintreatment.com.